Thank you. Dr. Muhammad Usman Ali, DHMS MBA, RHMP, Pakistan. Senior Consultant and Head of Department of Homeopathy, Al Mustafa Hospital, Pakistan. Consultant Homeopathist at Omar Homeopathy Clinic, Mentor, Morning Homeopathy Academy, expertise in mind and psychosomatic case analysis, Platinum Consultant and Doctors Panel, Portal. Topic is mental, physical, intellectual impairment and rehabilitation with homeopathy. This is an important topic. We all know that a lot of persons are suffering from all these problems, and there is no solution to their problem except certain drugs that will cause further damage to the patients. We know about the classification of mental disease, the corporeal originated diseases. Often the mental diseases are later convert to corporeal affections. So what happens when the wrong medication or not the drug is administered, the untoward incidents occurs. So on behalf of Ifph, welcome Dr. Usman. You can on the platform for next 40 minutes. It's over to you.
Sir, I'm audible, sir?
Yes.
So should I start, sir?
Yes, of course.
Thank you, sir. Thank you, Manoj, sir. I just want your permission to share my screen, sir.
Yes, you can share. You're the co-host. Okay, started.
So can you see the screen, sir?
Yes, yes.
So, in the name of Allah, the most beneficent, the most merciful, I would like to start today's presentation. Today is the Ifph Talks live webinar, 1300 first session, 24th March 2024. I welcome you all members, doctors, homeopaths, mentors, students, management, Ifph team, hosts, moderators in today's presentation. This is my brief introduction, sir. My name is Dr. Muhammad Usman, graduate from the University of Punjab, Masters in Business Administration, DHMS, RHMP. And visible are my numbers and emails. HOD Department of Homeopathy, Mustafa Hospital, a consultant, Omar Homeopathic Hospital Clinic, and a mentor to the Morning Homeopathy Academy. Today's topic is mental, physical, intellectual impairment and rehabilitation with homeopathy. This topic is very much important as you have given these words in the introduction of this topic. This topic has 4 basic components. The mental aspect of the disease, the physical aspect of the disease, intellectual aspect of the disease, and then we will discuss the rehabilitation with homeopathy. This is the most important component for all the homeopaths. But first of all, we have to look into the issue identification. This is the most important also, as when until or unless the issue is properly identified, it cannot be cured. So before going to the mental, physical, and intellectual aspect, we'll discuss briefly about the impairment. That what is impairment? Impairment is the state of having a physical or a mental condition. Just yeah, here I can see. The impairment is the state of having a physical or mental condition that part of your body or brain does not work properly. So if this is the thing in the patient, we call this such kind of an issue as an impairment. Impairment is a damage. We can also say that occurrence of a change for a worse. If it cannot be cured, it may go for a worse. So it is very important to clamp the disease at the impairment level. If it is not, then it may lead to the more worse condition. We can also describe the impairment as the condition of being unable to perform due to physical or mental unfitness. So here I have highlighted these two words, physical and mental unfitness. So this is very important in the health issue to determine the health of any particular person coming to the clinic of a homeopath. Homeopath has to understand the physical aspect and the mental aspect of that patient also. That if he is perfectly fine and considered to be healthy in all these conditions. Here, now we will discuss briefly about the impairment in comparison with the disorder and disability and handicap. We'll see the differentiation. It is also very important to understand the differentiation of impairment, disorder, disability, and handicap. Until or unless one cannot recognize that what is impairment, what is disorder, and what is disability and handicap, the treatment cannot be administered, because some are the things which can be curable, and here we can determine the stage of the disease. So if we coin these two terms, impairment and disorder, so it will be, they can be coined together. Impairment is the abnormality or disorder or loss of physiological, psychological, and functional disturbance. So I've again highlighted there the loss of physiological, psychological, and functional. These three are the most important aspects in the disorder or impairment. Disability is the wider aura. Although it generates from the impairment or a disorder, it is a wider aura that is lacking the ability to perform within the parameters of defined within the parameters defined for the human beings. So, if such is the condition, then we call it a disability. We cannot call it an impairment or a disorder. It is more severe form of impairment or disorder. Then comes the handicap. Handicap is the condition that is relatively a permanent issue, having an injury or illness that makes it difficult to do things that other can perform. So this is what the definition of handicap is. Others can do it easily and normally, but if the patient sitting in your clinic or the patient comes to the doctor, that is considered to be handicap if he cannot do all such things. Likewise, this is the brief introduction, brief comparison of impairment and all these things. Now we come to the topic basic component. We'll discuss the three basic components of our today's topic, starting with the mental impairment. Mental impairment have some bullet points here. You can see I've already highlighted them, the keywords between that. Mental impairment is the loss of mental capacity to supervise yourself. If you cannot supervise, if one cannot supervise, then it can be considered a mental impairment. It is also the ability to understand and make decisions about your life. So the important keyword is the supervise, then the decisions. The third is the ability to communicate and the capacity to make timely decisions. So the one aspect is decisions and the second aspect is timely decisions. We'll discuss briefly about all these in the next slide. The third bullet point is the significance. It's a significant disturbance of an individual cognition. So what is cognition? Cognition is the emotional regulation. So the cognitive mind or the emotional regulation disturbance is considered to be a mental impairment. It is also the reduced ability to reason logically and engage in purposeful behavior. So the word is logical reasoning. So it is another special thing that one cannot reason logically. It could be considered as a mental impairment. The further classification of mental impairment is the psychological disorder. Now we'll see all these bullet points with minor descriptions, as most of the doctors and senior doctors know all that, but this is for the students of homeopathy, as the students of homeopathy are also listening these webinars and to understand and to gain the knowledge. So for their convenience, the subclassification of I will discuss the subclassification of these mental impairments. These classifications I've already highlighted these bullet points in the previous, and these are all the life decisions, timely decisions, emotional regulation, and reason logically. So what we'll see first the self supervision. That what is self supervision? It's a self management basically. That if someone can manage himself or herself, that is called self-supervision. Regulating yourself within minimum to optimum standards and rules without external commands. If nobody is commanding and the person is doing it at his own, that is called self-supervision. If someone is commanding, that is not self-supervision. It is the ability to manage your own work, thoughts, and emotions. Again, I highlighted this work, thoughts, and emotions. And one more thing is the behavior. Work, thoughts, emotions, and behavior. Along with self-grooming. What is self-grooming? Self-grooming is taking care of personal hygiene and health. This all comes in the domain of self-supervision. This self-grooming or hygiene or health also contains further some things that are skin, body, hair, nails, dental care, and the outfit what someone wears. So this is all about the self-supervision. Now come to the life decisions. The life decisions, they have the four basic components. Choosing a way to live, choosing a way to live, how to live, and where to live. These are the life decisions one can take. And the decisions about the family, expanding a family, reducing a family, contacting, and the family relations. Then comes the finances. And afterwards, the fourth point under the life decisions is relationship. So now we come to the third aspect of the mental impairments, that is timely decisions. What timely decisions composed of have three basic components: eating, working, and wearing. That what to eat, what not to eat, at what time one should eat, how much to eat. So these are the self-supervision decisions in the domain of mental impairments or disorders. If someone cannot do all such things, then we pronounce that person to be the mentally impaired person. The working and the wearing. What to wear, where to wear, how to wear. Now, the fourth aspect of this is the emotional regulation. Manners, behavior, sleep, response or reaction to right or wrong. So manners are very much important. When the patient came to our clinic, most of the time the patient is a child. So you can see all these emotional regulations being complained by the parents to a doctor that manners are not like good, behavior of the child is not good, sleep disturbances, and the response or reaction to right or wrong. So this is another aspect of the impairment of mental impairments. Now we come to another second last point of the mental impairments, that is reason logically. The logical reasoning comprises of thinking, solving, and planning, and the last one is the implementing. First is the thought process. The one should think, then solve, plan, and implement. If all these aspects can be done independently without the help of another person, then we call it the healthy person. If any of these things cannot be done himself by the person, we call it an impairment, and that would be classified in the mental impairments. Now, the second component of our today's topic, the basic after the mental impairment, is the physical impairment. The word physical impairment is classified as the problems with the structure or organ of the body. The structure of the body is not correct, or if there is any problem with the structure of the body or organs of the body, we call it physically impaired person. As I have described, this impairment is somewhat different from disability and can be pronounced as disorder. So this implies to the physical impairment also, that we can call it a physical disorder. Disorder is treatable, while disability or handicap is they can be considered as a relatively permanent issues. Because if we treat a person at the stage of an impairment or a disorder, it will not convert into a disability or a lifelong handicap issue. So this now will come to the second slide of the physical impairment. We'll see the sub-classifications of our today's topics, physical impairments. So what are the sub-classifications of the physical impairment? That is dwarfishness. Here I've used two colors for the identification, easy identification of the physical impairments. We see, you can see the red, maroon color, dwarfishness, speech and language, specific learning, and mutism. They can be categorized in one head of the physical impairment, and intellectual impairment and mental retardation can be considered as the second aspect of the physical impairment. As patients came to us that the height of the child is not normal, they're dwarfish, so that can be considered as a physical impairment. If the speech or language issue, one cannot speak properly, or one cannot understand, that will be considered as the speech and language issue, as considered also considered in the physical impairment. Specific learning. Specific learning is the art, like art, mathematics. So these kind of things are the specific learnings. If a child cannot learn art, as we have the rubric in the repertory, is that art inability or ability for the art. So these are kind of the things. Another rubric comes to my mind is the mathematics inability. So these are the specific learning issues, and our repertory deals with this the rubrics of like mathematics and art ability. They fall in the specific learning, and the bigger aura falls in the physical impairment. And the mutism. Mutism is self-timidity. So bashful behavior, this is called mutism. Now, the intellectual impairment and mental retardation, they can be coined, and we'll see the intellectual impairment, the third basic component of our today's presentation. That what is intellectual impairment? Intellectual impairment is a cognitive impairment, limiting the mental functioning skill, such as communication, self-help, and social skills. The word impairment refers to reduced ability to reason, think, remember, and solve. Trouble concentrating, completing tasks, remembering, following instructions. So the trouble concentrating, as we have the rubrics in our repertory, concentration difficult. So these are all the intellectual impairments. That trouble concentrating, completing tasks, remembering, forgetfulness. So remember, if one cannot remember, that falls in the intellectual impairment. Someone who has intellectual impairments might make longer time to work through tasks and activities and needs support to learn. The intellectually impaired person will take a longer time. Here I marked it again in a highlighted, take longer time to work. We'll see how the longer time reflects in the coming slides of today's topic, that how homeopathically it can be understandable, and how we can see all these things as we have discussed in the previous slides about the mental impairments and physical impairments, actual impairments in the patient. Because all these discussions are the patients and their rehabilitations, and especially with the homeopathic perspective. So now the after the intellectual impairments, here we'll see the fourth and basic step of the rehabilitation. But to complete that rehabilitation, we have to first identify all these aspects in a patient. If the identification is proper, that we call that is a proper case taking. The SOPs of the case taking, all the SOPs of the case taking are well taken care of, then comes we can be able to rehabilitate that person. So here is a case of a homeopathic cure. As you can see on the slide, the case is from year 2022. Patient age is 15 years. Weight is 35 kg. Gender is female. The clinical notes of the patients are all written in the red marks. The red marks are chosen because to identify for all the audience to understand that what are the issues of the patient and how we can consider them the mentally impaired, physically and intellectually impaired. The clinical notes are primary amenorrhea, stunted physical growth and height. When we call stunted physical growth and height, these are two words, growth and height. Height is another aspect, and growth is related with the other organs of the body, overall body, and all other organs fall in the domain of the physical growth. In height itself, one can see that height is stunted or not stunted. So then mental retardation. These are all the aspects seen in the patients and noted as a clinical notes. Absence of intellectual understanding. The patient we are discussing here is the patient cannot understand intellectually. Dental impairments are also there. These dental impairments I've discussed in the previous slides were also fall in the domain of the physical impairment. Why we call it a dental impairment? As seen in the patient, that patient cannot chew food properly. Why the patient cannot chew food properly? Because the alignment of the teeth are not proper. The jaws are not properly aligned, that one can chew food easily. So these are the 5 basic clinical notes which were observed at the time of the case taking. Now we come to the case itself as the history of the case. His history. Patient belongs to a poor family. At the age of 3 years, her mother left the child to father and left home. Father also disowned and left the child to the owner of a shop where he used to work. Owner of the shop gave the child to his old age parents as a helper. So one thing here for all the audience to consider, especially the age of the patient. When the patient was at the age of 3 years, this all has been happening at the age of 3 years. Because I have titled it as a history of the patient. So moving forward, owner of the shop gave the child to his old age parents as a helper. After the death of the caretakers, child remained in the custody of their daughter-in-law. Cruel behavior, physical torture, malnutrition was borne by child in all those years up till now. As you can see, this all started at the age of 3 and the patient reported at the age of 15 years. As we can see in the previous slide, the patient age was 15 years now when the patient was reported. And this was the history. Another daughter-in-law of that family was kind enough to bring the girl for treatment, and that is all without the consent of their caretaker owner. They don't know, because they do not allow that child to leave home or to meet anybody. So this was all happens in their disguise. And one of their family member has helped the child. Maybe he has had some sympathy after seeing all that. So she was my patient and she take that child to me. The girl didn't know what she was here for. The patient itself does not know that why is here for, why she is here for. So this is all the scenario or history of the patient, which is very important to be narrated, as one can understand how all that years, if we minus 3 years from the girl's age, that is of 15 years, that all has been borne by her for the last 12 years. And what those 12 years has impacted on her health and all the overall well-being was the physical, mental, and intellectual impairment. And what were all those physical and mental impairments? We see in the next slide. Observations. These are all the observations as a physician. And they are all written in the red marks for your clear understandings. Patient has no feelings. I talk to the patient has no feelings. Second aspect, no emotions. Child has no emotions, no feelings, no sense of right or wrong. Timid during all the conversation. Remain sitting idle, timid during the conversation. Lacks ability to express, answer, and narrate. It also this sentence comprises of three things: lacks ability to express, answer, and narrate. Cannot narrate, cannot answer, cannot express herself. Then another observation was cannot speak properly even a sentence. Child cannot speak even one sentence clearly or completely. Further observations. These are all my observations as a physician. And further observations were required from the one who brings the child to the clinic. Remains timid all day. That daughter-in-law of that family who brings the child to me, she says that she remains timid all the day. सारा दिन खामोश रहती है. In Urdu. Weeps often. कभी-कभी रोती भी है. Weeps often. But the reason why she is weeping for, they never come to know that why she is weeping. Because no emotions, no feelings, no expressions, cannot say anything to their caretaker that if she is feeling anything wrong or not like that. Lack of appetite. That the family member of that who brings it to me says that कभी खा लेती है, दिल करे तो खा लेती है, दिल करे तो नहीं खाती. Lack of appetite. Keep on doing any given task for hours. When she says that she keeps on doing any given task for hours, I asked her if you can explain further, classify this thing that keep on doing any task for hours. What do you mean by that? She says that if she starts eating, she will keep on eating for the 3 hours. I said that will she eat more in all that? No, she will not eat more. The one we was given to her, she will not complete it in 3 hours. Keep on eating slowly. And then I say that is there any other example if you can quote to make me understand that as she was a helper, if she was asked to wash the utensils, keep on washing for 4 or 5 hours. So these are all the observations of mine and the observation further taken from the person who brings the child. And history I have already briefed. These all the issues make the child so miserable that she is mentally, physically, and intellectually impaired. Here comes the repertorial analysis of this case. I've highlighted and used 4 colors. First, we will discuss about those rubrics from the repertory which are written in red tone. But before that, we have to understand that after taking a case, here comes the stage for a homeopath to for the totality of the case, because totality is very much important. as I have seen all the clinical notes, observations, history acquired from the about the patient, and uh, further observations also acquired from the person who bring the patient. So then comes the conclusion stage. Here we call it this is the fourth component of our today's presentation, that is rehabilitation. First of all, we have identified that what are the problems, then we categorize them, and afterwards the process of rehabilitation. And for that process to rehabilitate, the most important aspect is to identify the appropriate rubrics. Here comes the importance of the repertory also. That why we homeopaths should use a repertory. The repertory will make us make us able to identify the true essence of all that. So the first I will discuss the rubric of ailments from absence of father. Second, ailments from being neglected by one's mothers. The third is the ailments from responsibility too early. These rubrics are already self-explanatory. As father has left the child at the age of 3, mother has left the child at the age of 3. The child has been neglected by both of them. And then what comes to the child? Responsibility. Because when both the parents left the child become the helper of another family who is taking care of that child, and they make him responsible for all the household works of their. So if we look at the age of the child, so we can say that it is responsibility too early. Now we come to the rubrics written in the blue format. Ailments from abused after being. Child was abused. How she can be abused? I've asked one question that to the person, the daughter-in-law who brings the child, that how you can say that he's been. उसने उर्दू में कहा, इसका काम है मार खाना और काम करना. You can pronounce this thing as that इसका काम है मार खाना. His job is to be beaten and to do work, and do not react and respond in all that. So elements from abused after being. Then comes the domination. As clearly seen, the domination is being dominated by that family, and then comes the domination for a long time, starting from the age of 3 and till the age of 15 years, domination for a long time. Then comes the ailments from punishment. When you do not complete the task, then she already explained that maar khana, then being beaten, maar khana and kaam karna. So ailments from punishment, ailments from reprimands. Now the two rubrics written in the black are ailments from abused after being and ailments from domination, children in parental control, long history of excessive harsh upbringing. So this is very much important rubric, that long history of excessive harsh upbringing. Now we'll go to another slide of this rehabilitation part of this case. the further rubrics. Previous ones are the ailments. That is the uh, uh, adaptation of that case that we have acquired, that what has been happened in the last previous years and being borne by the patient. So that we call an adaptation. Adaptation falls in the ailments. As the case has been resolved using a mind method, so that is why I've been explaining. Most of the audience who may have been sitting here and know about the mind and Segal's protocol, they will clearly understand about the adaptation. Now the further rubrics we'll discuss two written in the red tone. One is mildness. This is the perfect example of mildness rubric. Here you can see that what mildness is. Mildness is not responding, not reacting. In the severe issues, in the severe health problems, in any kind of severity being borne by a person, and if the person is not reacting, we call it mildness. So the mildness, and the specific one is in children, because there is a rubric in the repertory that that is mind mildness, and then another rubric is mildness in children. This another red one is the development of children arrested, mental development. Okay, now what happened to the child is height, as the clinical notes previously, if anybody has joined now, for their convenience, I can go to the previous slide of the clinical notes. Here you can see the primary amenorrhea, stunted physical growth and height in that patient. So the height wasn't appropriate. Height was, the patient was dwarfish, and the physical growth. And primary amenorrhea is because patient is at the age of 15, but no signs of puberty and no physical growth appearance as a girl at the age of 15. And the dental impairment, cannot food chew properly. So now, so these are the developmental issues, and the rubric is very much appropriate about the case development of children arrested, mental development. Here the mental development, how we can understand that mental development is arrested, because she cannot explain even a sentence. She cannot explain her own issues. She do not know where her parents were. She do not know where her other siblings were. She has no emotions. She has nothing about no emotions about the mother who left the child, about the father who left the child. So these are all the issues with the child. Now, another rubric written in the blue format is timidity children in towards others. As the child is timid and the also remains timid at the house, if anyone comes, she not known to him other than that family, she remains timid. 4 rubrics written in the black format are admonition, aggravation in children. As everybody knows that what is admonition, so I cannot go in that what admonition is. Timidity children in yielding disposition. Despite all that aspects, the person is yielding, doing, not saying no to them, that I cannot do all that. So this is yielding, always saying yes to them when they ask any task, because she was a helper. So overall aspect, what happened? The development of child is arrested, and we have a rubric in the repertory. The development of the child is arrested. So these are all the identification patterns what we have discussed till now about the case. First, we have identified that the what case actually is. Then we see the history of the that case. Then clearly identified that mental impairment is there, physical impairment is there, intellectual impairment is there. Then choosing the appropriate way and interpreting that all those conditions into the format of a repertory. We have to select an appropriate rubric because patients do not know what doctor is doing on their laptop or on their computer or with the books. So the task of the physician is first to take a case, then interpret it into a homeopathic language in the form of a repertory, and then afterwards conforming it with the materia medica. Now comes the further component of that rehabilitation. As we have identified all the aspects and identified the rubrics as well. Now we'll see what remedy comes to us with all that. The remedy comes to us is carcinosinum. Carci was given in 200 and only one dose. One dose carcinosinum given in 200 at the day of the case taking. Then comes the follow-up. First follow-up after 8 days. As I have asked the person who brings the child to me that if you are kind enough, so be kind enough to me as well. If you are not kind enough to child anymore in the days to come, be kind enough to me that bring the child for the follow-up. So I can understand how the things progress in that case. And she helped in all that and bring the child again after 8 days. That was in June 22. Many large worms expelled. After giving a dose to the patient, what happened? That is not explained by the child himself at first because she was quite timid, and the difference, what difference happens in 8 days is she narrated one sentence to me at the follow-up. बड़े बड़े कीड़े निकले थे. Many large worms expelled. She just only knows this. And the person also confirms that she is telling truth. When this happens, she got a prayer and we confirm that this happens. And then comes the further stage of the at the follow-up, one more dose given of the carcinosin in the same potency. Then comes the second follow-up. Second follow-up was reported 8 months, after 8 months of the first follow-up. I mentioned the date also. And now I have written all those things which were being observed in previous slides. They were red. Now I have written all of them in green. This green is because now what comes after 8 months is patient comes with a smiling face. Height increased 2 inches and weight increased 5 kg. Then talking and explaining herself. She was the same child, cannot speak even a sentence, and now today enters the clinic smiling, talking and explaining herself, speaking sentences properly, knows what she is talking about. This is very much important. Knows what she is talking about. Intellectual and intellect was improved so much that she knows what she is talking about. I said, where you have gone all those days? you haven't come early as you have to supposed to come early to me. Why you have come to me after 8 months? She said, I'm not here. I've gone to another city. That's why I'm not I was not able to come to you. So this was the proper sentence she speaks, and explained the situation that why she was not here. And before that, nothing was like that. Now she can chew food properly. The denture alignment, if the word we can choose it appropriate for that is the alignment of the teeth. They also get beneficial in with this medicine, that this physical impairment also get help in chewing the food properly. Now, after 8 months, one more dose given of the same potency. Now, what happened? Further follow. This again after 8 months. That further follow-ups again taken after 8 months. Date also mentioned. Report, and this follow-up was reported by the daughter-in-law who brings the child on day 1, because at that follow-up, the child was not present, as she was unable to bring the child. So what were the observations? Menstrual cycle started. The main thing that at the age now, if we add up these 16 months at the age of the child almost nearing 17 years. Now the cycle started, which was clinically observed previously. Clinical notes that primary amenorrhea. Height increased further. Physical development and breast development. There were no signs of physical and breast development at the age of 15 when the patient was reported. Marked improvement in overall general health reported. Here you can see that what carcinosinum has done in the rehabilitation process of the patient in getting and restoring the health, which was of a severe or grave nature, and may have had converted into, as discussed in the start of the webinar, that the child may have been handicapped if not treated, may have been a permanent disabilities or problems like that, which cannot be cured at the later stage of that ages. So what comes further is, I thank you all for listening me for the whole 1 hour. Thank you all members, participants, moderators, today's moderators, and especially the International Forum for Promoting Homeopathy for giving me a chance to bring up a case and a classical cure of single remedy homeopathy. And so there's this is my phone number as on WhatsApp and email. If anyone has had some queries, as the time is getting close to wind up the session, so I may not be able to take more of the questions. We'll try to do it. So this is the number. If anyone can, please, Dr. Manoj sir, over to you, sir.
Yes. It's a wonderful presentation. No words to appreciate or explain beyond words. A wonderful, magical transformation was brought by the medicine with your intelligence and your patience and the applications. Nice one. Time for discussion. 5 minutes remaining. Those who like to participate, please raise your hand. I think this case might have exceeded even Hanuman's dream. That much transformation. Girl, age 50, with all sorts of troubles, as mentioned by our master in the aforesaid 229. There is no solace for a soul that frets and pines in the chains of the diseased body. but here you provided the magical medicine, and we must thank that lady who brought the child to you. That's the most
Yeah.
important thing. Yes. Dr. Ram Parvez Shah is there. Sir, you can unmute now. Yes. Yes, sir. Please.
Thank you, Dr. Muhammad Usman Sahab.
Thank you, sir.
Very,
Ram
very
Parvez, sir.
thanks. Very, very thanks. Excellent session. Beautiful describe mental, physical improvement, mental growth and physical growth. Nice presentation. Beautiful case, carcinosine. Carcinosine is a very good remedy. Mental, physical growth. Very, very thanks.
Thank you, sir. Thank you. Thank you.
Okay. Yes. As I mentioned by this medicine.
Classical होता है.
Yes, carcinosin is a wonderful. Not only carcinosin, all medicines are like that. But when we apply in the right case, right perspective, it will work. That is the most important thing. I think the analysis I made is really wonderful. You just mentioned the bullet points first. The mental impairment. Yes, explain what do you mean by this mental impairment. In the physical impairment, what are they? How to differentiate? Then went through each and every symptoms scrupulously and converted into a successful, beautiful case. We must not only congratulate, but we must salute you for providing
Sir,
such.
thank you. Thank you,
Especially
sir. Thank you.
when that child is a girl child, we cannot imagine the suffering she is because the mother left her, the father left her, then nobody is there to look after, and one person who is all thoughts of torturing her. Then fortunately, by God's grace, she got a company, and that lady brought the child to you. Then, like a physician like you, they survived. Then what is the latest situation, doctor?
Latest situation is she is improving absolutely fine.
I think such cases, some videos are very much convincing or very much good for our participants, definitely.
Sir, I have the documentation and records of that, but due to the patient is a girl child, and I don't have the consent of that family, so I just can't share it without the consent of that. I have the data about that, but
one thing I am sure that if you are belong to the allopathic side, definitely they will provide you a Nobel Prize for such case. There is no doubt of that. It is a genetic treatment, transformation. It's not at all easy to make such a patient. Don't have the proper dental arts, don't have the secondary sexual characters. Nothing is there, no mental development, but with single medicine, you brought the wonderful thing. So definitely,
So
it's a great work of genius. There's no doubt of that.
so the most important aspect as part of a homeopath is that many doctors at one point, like homeopath is a psychiatrist at the moment, cardiologist at the moment of that patient, neurologist of the patient, hepatologist, rheumatologist, nephrologist of that patient, because the person is taking the doctor is a homeopath as taking a case as a total entity.
Yes.
We have been integrating mind, we have been integrating physical disorders and disease. What disease is? Disease is dis-ease, basically.
Okay.
So we have to understand the physical aspects, mental aspects, and all that. So the homeopath should be a born psychiatrist as well.
Yes, that's good. It's time for conclusion. May invite definitely the exalted or elated Ram Parvez Shah to express vote of thanks to Dr. Usman. Sir, please. We'll be very happy. Yes, sir.
Thank you. Thank you, Dr. Usman Sahabji. Very nice presentation. Classical homeopathy. Beautiful describe.
Sir, thank you. Sir, thank you.
Presentation case for behalf of IFPH very thanks, Dr.
Sir,
Sir.
thank you. Sir, thank you. Sir, thank you.
Thank you.
Yes.
For
Okay.
your kind and nice words, sir. Thank you.
Again,
Obliged.
presentation and IFPH. Thank you.
Hopefully, sir, hopefully.
Yes, this is a platform to appreciate, to communicate, to educate all the way. So it's a nice presentation. Please come with similar presentation in the IFPH platform. The remark
you, Dr. Manoj.
includes today's English edition, day 1301. So we'll be back again tomorrow. Till then, goodbye, and over to Malayalam session for Dr. Shaila. Over to Dr. Shaila, please.
Thank you, sir. Thank you.
Thank you, Dr. Manoj.